system, available exclusively from Zahn Dental. The Zerlux FC system consists of 5 shades of pre-shaded isostatically pressed high translucency zirconia and a coordinated system of stains and modifiers. Using the 5 base shades of zirconia, all 16 A through D and 3 bleach shades can be achieved using a simple stain and glaze procedure. To get started, the laboratory only needs to purchase the Zerlux FC characterization kit, which contains all stains, modifiers, and glaze that are part of the Zerlux FC system. Laboratories can either purchase Zerlux FC discs from Zahn Dental to mill their own restorations, or work with an outsourcing center to purchase sintered, milled Zerlux FC restorations that can be stained and glazed in the laboratory. After the Zerlux FC restoration is milled and sintered, it will require some light finishing. Using a cylinder-shaped fine diamond burr, remove any sprue attachments or milling marks which you do not want to show in the anatomy of the restoration. Use water to lubricate and cool the restoration while finishing. Once you have achieved the proper surface texture, you should then blast the restoration surface with 50-micron aluminum oxide compound. It is important not to exceed 50 microns in particle size and to use no more than 50 psi. Finally, polish occlusal contacts with polishers indicated for use on zirconia restorations. Use a steam or ultrasonic cleaner for 15 minutes to remove any debris from the restoration. It is important that the surface of the zirconia is free from dirt, milling dust, residue, and oily, greasy elements. The Zerlux FC system utilizes 7 stain pastes that are numbered 1 through 7. The stains are used to modify the base shade of the sintered restoration, allowing the technician to achieve all A through D and 3 bleach shades. Utilize the stain coordination chart found in your instructions for use when preparing for the stain and glaze procedure. In the following example, we will produce an A2 crown. Per the shade coordination chart, only a single staining step is necessary. To begin, a Zerlux FC shade 201 crown was milled. We will use stain number 2 to stain the crown to a final shade of A2. Be sure to thoroughly mix stain pastes before each use. If necessary, wet your brush with universal glaze medium to thin paste on the stain palette. A creamy or honey-like consistency should be achieved. Use a shade tab or patient photo to plan the amount and position of color on the restoration. Lightly apply the appropriate stain paste to the cervical and middle third of the restoration to reach the desired shade. Apply stains to the occlusal area of the restoration as needed to provide a more realistic appearance. Fill the restoration with stabilization paste and set on a firing pin. Fire using the parameters outlined in your instructions for use. The Zerlux FC system has 7 modifier pastes that can be used for adding individual effects to restorations. For example, blue and gray can be used to mimic incisal translucency. White can be used to mimic decalcification, and orange or dark orange modifiers can be used for enhancing chroma and fissure staining. Additionally, pink modifier is available to mimic internal effects sometimes seen in natural dentition. Light application of modifiers is all that is needed to achieve a lifelike result. Application of blue, gray, and white modifiers to the cusps and dark orange modifier to the occlusal surface complete the case requirements for this restoration. Fill the restoration with stabilization paste and set on a firing pin. Fire using the parameters outlined in your instructions for use. Once the stain firing is complete, the glazing process can begin. It is recommended to fire the glaze separate from the stains to avoid displacement of the stains. Mix the glaze to a creamy or honey-like consistency. It is important not to thin the glaze too much, as this will inhibit proper coating of the restoration. Apply Zerlux FC glaze to the entire restoration and fire per the parameters listed in your instructions for use. Once the restoration is fired, inspect it to ensure proper shading, glaze coverage, and aesthetic result. The restoration is now ready to be delivered to the doctor for placement.